The new variant of COVID-19 virus, Omicron, has been in world news for the past whole week. Its unclear behavioral pattern has been the cause of concern since its early spread in South Africa. The medical fraternity is yet to be sure about its symptoms and seriousness, but according to a South African doctor, Dr. Angelique Coetzee, its symptoms are quite easy to miss.
I alerted the advisory committee. Simultaneously in the background, our labs in Lancet did also find on their PCR tests that there was a strange thing going on where what we call an S gene fallout that they normally will not see with Delta, and they also reported it. So at last week, it was then confirmed that South Africa saw a new variant. So I think this variant has been around for some time. Maybe not so in South Africa, but in other countries, because other countries are seeing quite a high rise or increase in their numbers of infections. And if you're not clinically aware of what is happening, you would very, very easily miss the symptoms of this patient.
There is more research going on currently on this variant, which has already shown more than 50 mutations in its structure itself. So despite the uncertainty about its life-threatening capacity or the ability to spread, the doctors are suggesting us to be quite alert this time.
So now that they say, and this is what is worrisome, is that the R0 factor of this virus, this variant, which has now got 50 variations, now they call it Omicron, that it is maybe 12 to 18 times or even higher, the R0 factor. That means it could be a very devastating spread. Okay. So right now, the worry is, what is it? We don't know the exact details of it, and we should not be careless or feel कि कोई बात नहीं, it'll be okay. There is nothing to suggest that it is going to be okay, and there is nothing to suggest that it is going to be devastating. All we know is that we are in a very tricky situation because we have found in South Africa, they identified this new variant which has 30 variants plus variants on the spike protein itself and more than 50 variants in the whole structure of the virus. Now, how it will behave, we don't know, but if you look at the preliminary data from South Africa, it says that in one day it can double the number of cases. So that is what is a fact which is actually putting the whole world on alert, and that's where we should be. We should be 100% on the alert